This program is brought to you by the Georgia Neurosurgical Institute. For over 50 years, rendering neurosurgical care to patients of all social conditions, treating complicated problems involving the brain, spine, spinal cord, and peripheral nerves, endeavoring to encourage quality care, medical research, innovation, and education on a local, national, and international basis.
Good evening. My name is Joe Sam Robinson. Welcome tonight. It's my pleasure to have Mindy Hartley, who is the Director of Nursing at the Houston County Medical Center. And maybe we can talk some tonight, Mindy, about your adventures as the generalissimo of all the nurses in a big hospital and all the responsibilities you have. How many nurses are under your dominion at Houston County?
Well, we have 738 nurses at Houston Healthcare between the hospitals and the med stops and all of those, which equates to 33% of our whole employee workforce. We have a little over 2,200 employees at Houston Healthcare.
Wow, so you have lots of responsibilities. That's a big deal, isn't it? And so how did you get to your present position? I mean, how did you start out in nursing as a young pup, or how did it happen?
Many years ago.
Yes.
We won't go back and talk about all those years. But yes, I started out in nursing. I had always wanted to be a nurse, and I actually am from Savannah, Georgia,
Yes.
where I graduated at Armstrong Atlantic State University.
Yes, well, good for you.
Mm-hmm.
And let's see, I think you have, you were mentioning to me that you might have delayed your entrance into nursing. You had some kids, you had 2 children, is that
I
right?
sure did. I have 2 children in their mid-20s. I have Galvin, who's in Atlanta, Georgia
Good.
now.
Now get the full name out there.
Yeah.
That's this is one of the things you can do. Galvin is in Atlanta, Georgia.
Right.
And is Galvin married or?
No, he's single
Okay,
right now.
all right, just checking.
Having
Okay.
a good time in
Well,
Atlanta.
that happens.
Working, he's a programmer up there for a startup biotech company, which he's really enjoying very much.
Good.
And then my daughter Morgan is in local area. She goes to Macon State College and is working on a business degree.
Well, good for you. Good for you. Good for your daughter. So you have the nice children there, obviously. Well, let's see. So you were you started nursing in Savannah, and then what happened after that?
Well, you know, the exciting thing about nursing is it provides you with the opportunity to go into a lot of different directions,
Yes.
and it gives you a lot of variety. And I started out as a pulmonary nurse on a med-surg floor,
Yes.
and shortly went into education,
Yes.
and was educating new grad nurses in a residency program.
Yes.
Then I became the manager for a float pool of nurses.
Yes.
It was an in-house agency nursing group of over 100 nurses.
Wow.
And then I was the director of mission services at Savannah, Georgia.
Yes.
And then my husband said he had a job opportunity in Cordele, Georgia.
Yeah, that's where they grow the watermelons. Is that
It's
right?
the watermelon capital of the
listening
world.
to anyone out on in TV land that's from Cordele, I'm sure they'll agree. There are lots of watermelons from Crisp County.
Right.
So you live there and in Crisp County, and
Well, I don't now. I live up in Byron. We came over and he started working down there, and I really loved Cordele. It's a very nice community, but it did not offer a lot of opportunities for nurses.
Yes.
They, at that time, didn't really have any jobs at the hospital there.
Right.
So I came up to this area and interviewed at Houston County, Houston Healthcare, and was very impressed with the growth, was impressed with the opportunity, and have really enjoyed working at Houston Healthcare with the base nearby, which we have a great relationship and really do respect and admire that relationship and are glad to have it. And the growth in this community has been very positive. So when I started out at Houston Healthcare, I started out as a director, and I worked into the position of Assistant Chief Nursing Officer, and then about 2 years ago, I took the role on as Vice President for Patient Care and Chief Nursing Officer.
Well, I dare say that patient welfare at any hospital depends on the good offices of the nurses. Is that an understatement?
Well, you know, I mean, one of the things that we do like to think about and often talk with our physicians is the nurse is the eye and ear for the physician. When the physician's not there, you know, we are there with our patients. It's very important as a nurse. We do many things. We multitask. We certainly want to be the advocate for that nurse and be able to do many different things. It's grown over the years. Nursing has really changed over the years from just doing very minor things of bathing patients to medication delivery, starting IVs, doing many complex tasks now as a nurse.
Well, actually, I mean, I'm a sort of a big proponent of this, the idea of a healthcare team. And I mean, I think anyone that's a patient understands the importance of a nurse, and the whole profession is a very noble one, and it's good to see it prospering in a way. Now, becoming a nurse is a good career path many times, isn't it? I mean, particularly in a time that jobs are hard to come by. Any comments about that? Is there a big demand for nurses these days?
That's a great point. You know, when the recession started...
I'm going to throw you some softballs.
Throw me some, I'll catch them.
Right.
I appreciate that. Well, you know, in 2007, when the recession started and things started taking a nosedive for many professions, and different employers were laying off,
yes,
nursing was a very solid field for individuals to go into.
Yes.
Over the course of the last several years, hospitals and other entities have continued to hire nurses as well as other healthcare providers, but it's been very solid. One of the things that I think is important for people to realize, while we have we're in a temporary sweet zone, I like to say, to where we have the vacancy rate for hospitals and other places have gone down in relation to nurses. But again, it's short-lived when you look at some of the data and statistics coming out there, and it's a great opportunity. Of the nursing force in America, 60% of nurses are employed in hospital settings, so that is where the majority of them go. But there's other great places to go as a nurse, places like home health care, working for physicians and physician
well, that
practices.
would depend on the physician, would it not? Yes.
Well, you know that well, too.
So I do.
You do. Managed care opportunities where nurses can work. Faculty, that's another area. There's a growing shortage of faculty members going into the profession. So it's a great place for people to go and to be able to go and get a position when they graduate.
Yeah, and then, let's see, traditionally I think we, at least the image from more antediluvian times was the nurse with the cap and sort of pretty rigid person, and it's quite different now, and they're males. A substantial number of nurses are males, are they not?
Most definitely. We're seeing more and more again. We started seeing probably 4 and 5 years ago males trickle into the profession, but we've seen quite a few go in there now. They do tend to flock to certain areas. It's kind of like a culture, you know, different groups like different things, but many of the males that have gone into nursing at Houston Healthcare, quite a few of them have gone on the med-surg floor. Another group has gone to the emergency department, and ICU tends to have many male nurses in there.
And those are areas, I guess, of you might say more intensity, so they seem to go there for possibly that reason.
Yeah, the adrenaline rush.
Yes, that's right. So it's good. And so you have those 738 employees. That's a big responsibility, isn't it? Is there an art form to staffing? I mean, it's quite a trick, isn't it? And is there a problem about staffing late at night? And how do you handle that? How do you get people where they need to go?
Well, as you can imagine, running a 24/7 operation does have its challenges. There are different incentives and programs that one can put in place, which we have done. We do have a work-only weekend program for some nurses. We also have programs such as we have incentive pay for nights and for weekends that many people do tend to want to go to those types of shifts. We also have the opportunity, if an individual wants to be a full-time individual and work either a 0.9 position, which means they work 3 12 hours a week, and they're off 4 shifts. We have some nurses that work part-time to where they work 20 hours a week. So we try to appeal to different types of individuals to be able to meet the needs for our patient care.
Yes, and well, we discussed this a little bit earlier, but one problem is the wrong turn of phrase, but there's an enormous amount of paperwork that's a part of the nurse's, I guess, task these days, and it might interfere with patient contact. Or do you have any comments about that? We're discussing some of your ideas on the subject.
Absolutely, and you make a great point. One of the things, we're very torn and very pulled. And the big thing that we strive to do in our hospital is to really be able to get the nurse back to the bedside, all of our caregivers back to the bedside, spending time with that patient. Documentation is a necessary evil.
Yes.
If one of the things that we always hear about when we're in school is if
Yes.
it's not documented, it's not done.
Yes.
So we have to be careful about being pulled with that. But you know, we've done some different things. We did have a pilot study where we actually did a time study to see how much time our nurses were spending with our patients. And we saw that they were spending about 38% of their time on documentation.
That sounds like a lot. Is some of that government mandates? Is that true? So there's paperwork is being. I mean, sometimes paperwork is good, and then sometimes it can be laborious and probably, if I can dare use this word, inappropriate. But we are getting a lot of mandates in our system that requires an enormous amount of documentation. I mean, that's fair enough, isn't it?
Oh, it definitely is fair enough, and I'm sure you as a physician realize that as well as I do. What we've done is, and we were able to reduce that number down to the low 30s by doing some things to improve it. We are really embracing technology, and we are getting ready to go with an upgrade in our technology that should be more similar to a point and click with Windows.
Yes.
The other thing that we've done is we have what's called computers on wheels, to where we can take that computer in the room and make that a part of when we're talking to our patients, so we can look up patient information and document on that. In some of our rooms, we actually have computers at the bedside so that we can spend more time with our patients. It's one of those things we will continue to work on.
Yes, so we were discussing possibly a little earlier the idea of the necessity for statistics and outcome analysis, and that's as we put the American healthcare system, I guess, into this century. The idea is that we're going to have some notion of value, what the system is contributing to value, and we have to be able to say, well, how much pain did this patient experience? Did the patient was out of bed soon enough? And how did things actually turn out for the patient? And so one thing nurses do is put that information in the system.
Yeah, I do feel that nurses are in a great place, a unique place to be able to assist with a lot of that.
Yes.
To really be able to improve the quality outcomes for patients. Falls is a great example, which is considered a nursing sensitive indicator by the National Quality Forum. And nurses and patient care technicians and others play a huge role on rounding on that patient regularly to make sure they're safe. Infection rates, making sure that we are washing our hands, but also informing the family and the visitors in there and helping to coach them while they're in the hospital, but give them information as to what they can do when they leave. Because that hospital is one small snapshot. So if we can help them also bridge that and provide them with information, then they'll live a better quality of life once they're discharged.
Yes, and so really, and if I think people that can recollect their stay in the hospital, they may have had sort of an en passant relationship with the doctor. He would come in, say something, and then vanish. But the real time that the real person that's there is the caregiver, is the nurse, and they get a sense of the patient's needs and just how care is progressing, and communicating that to the physician is really an important task, is it not?
Most definitely, and many times what you'll find is when that nurse is rounding and in there with that physician, sharing with the physician what was going on with that patient at night, talking to the doctor about the orders, having that collaborative relationship with that physician. There's also a lot of when that doctor leaves, many times that nurse is interpreting some of the things the doctor may have said as well, and helping to make sure that that patient understands exactly what was going on and what was said.
And I think a big thing too is communicating to the doctor, well, this patient is disturbed for whatever reason. They're concerned about something. Maybe it's irrational, but possibly you could put their fears to rest. I mean, having that interchange is a really important thing.
Most definitely.
One of the things going on in the American healthcare system is the idea of mid-level providers. So there's sort of a niche that's starting to, I guess, be put in place, and they're nurse, I guess, clinicians. They're taking steps in that direction. Can you discuss that? Or?
Oh, sure. I'd be very happy to.
Here's another softball.
Another softball. Let me catch that one too.
You got it, I think.
One of the things I think that when I talk to a lot of my friends about nursing, or if their children are considering nursing, it can be very challenging to understand the different levels that you can go into for nursing. we're lucky to have many different programs here. We have licensed practical nursing programs where you can go for 18 to 24 months and receive a degree as a nurse. We have associate degree programs, which basically, if you go full-time, is a 2-year degree, and you become a registered nurse. There's a 4-year degree program, which is considered a baccalaureate program, and you become a registered nurse after you sit for the NCLEX. And then what you're discussing is the advanced practice nurse, and that's your nurse practitioners, your nurse midwives, your clinical nurse specialists. And those nurses go on to receive a master's degree. They also take an advanced practice test in order to be able to practice in that, and they're able to really practice at a different level. Now in Georgia and across the United States, one of the pushes that has gone on is for those nurse practitioners, for those advanced practice nurses to become doctoral prepared. So because of the complexities of medicine, because of the needs to understand science, there really is a push to really become more professionally educated with that. And those that they will grandfather the nurse practitioners in, but the push is by 2015 to go to that doctoral prepared level for your advanced practice nurse practitioner.
Well, that seems like an important role. What I see, at least, is there's a physician shortage for lots of reasons in the country. There's an enormous need for a healthcare system that can respond to an aged population. So the actual requirements in our healthcare system really mandate that we have more mid-level providers and an effective, if I use this phrase, nursing workforce that's there ready to help. And it sounds like it would be impossible to function. The hospital couldn't work without the nurses. The doctors couldn't function without nurses. And it's important to have them in place. Well, is there, as you look in the future, do you have any, what would you like to improve in your world? What are some ideas for improvements?
Well, I guess what you're talking about, I mean, really is quite on point when you look at, I mean, Georgia is one of the most populous states. It's like the 9th most populous state. We're going to continue to grow over the course of the next several years, so we will continue to need nurses. When you couple with that the aging population, and between now and 2030 in Georgia, the population over the age of 65 is expected to grow by 143%. So I do believe there's several things that we should be focusing on doing, and nursing and a lot of other healthcare providers can help with this, but we need to look at programs with preventive care. We need to really see how we can help individuals live a very quality life. We need to look at things like healthy eating and encourage that. Not smoking and those kinds of things. And I think that nurses are very well positioned to help with that education. And you make a point too, physicians, a growing shortage with physicians. So we need to see how we can expand on what the nurses can do in their practice environment to assist with the physician shortage. Those advanced practice nurses have the opportunity to be able to help with some of those things.
Well, I'm a big proponent of if I could say this, the team concept in looking after patients. The idea there's a healthcare team in place, particularly in a hospital setting. It's very important that I think, and I think that's the general trend. I mean, the physicians, if they have any, what's the right phrase here, knowledge of the world, it's very important to have the nurses on their side and to be able to together help the patient, and that's just a mandatory kind of thing. And you want to talk a little bit about that? I mean, the relationship between physicians and nurses in a hospital setting. I mean, obviously there are tensions occasionally. I mean, how is that working out these days? Do you have any thoughts about that?
Well, I do, and actually a book I read, Why Hospitals Should Fly by John Nance. I don't know if you've ever read it or not.
No.
But it talks about that type of collaborative relationship and how that the best case scenario is that everybody is really there as a team, is very valuable as a team member, and has the ability to speak up if there's a timeout that hasn't occurred related to a procedure being performed. Then anybody in the room room has the ability to say stop. We've got to make sure that we're doing all of those right things. So I think to really have that collaboration and work like that is the absolute best way to go. It's utopia, and we have to always strive to work in that type of environment.
You know, I think that's one of the things that's important just in general in medicine or in any kind of structure where there's it's possible to make a mistake and injure someone. So the idea of checklists, the idea of anybody saying there's something wrong, and certainly I think in a more traditional culture, shall we say that a very dominating physician would intimidate people. They couldn't say, well, doctor, you've made a mistake. And if that's the culture, it's a bad one, isn't it? So the most junior person needs to be able to say there's something wrong. And I won't talk too much about this, but the idea of one of the things that allegedly in a operating room setting that lowers death rates and bad outcomes is there sort of a new idea of a checklist, and in the checklist everybody sounds, I don't know how the public's going to take it or how physicians will take it, but the idea is that prior to an operation everyone in the room would introduce themselves and say what their mission was. I mean, my name is just every most junior to the most senior person, to sort of focus the team on that kind of outcome, getting the best outcome. And I think it's really important. I hope your nurses at Houston County tell the doctors when they're making errors. Do they do that? I hope they do.
Well, I hope they do in every situation as well.
Yes,
I think it's very important to do that and to feel like that. I hope that we as the executive leadership team and that we encourage that as well for those staff to do that. I do feel that we have an extremely supportive board. Our board of trustees, it's an all-volunteer board of trustees, and they have been very good and very positive related to talking personally to me about, do you need more staff? Do you need more equipment? Are you having any problems?
Right.
I mean, they have been very supportive, and I think that's the type of leadership and board you need to have with that. And, you know, to me, the points that you're making are very similar to a high reliability organization. Certainly when you look at nuclear submarine businesses, when you look at the airline industry, that's the way they operate. And they do operate on checklists, and it's very appropriate. And that's one of the changes that we truly are seeing in medicine in the hospitals. And we're using more and more of that in our hospital setting. Bloodstream infections. What we have done is that we have lowered the rate of our bloodstream infections over the course of the last year by close to 80% by using checklists, by using very specific things that we standardize through there. So I agree with you completely that those are the things that we need to do, is to standardize all of that. And we have to work very hard every day at doing that because it is new for healthcare. It's not something we've done in the past, but I agree that that's the way to move.
Well, obviously we have to minimize any kind of errors that occur in any healthcare setting, but in hospitals it's certainly possible that errors can occur. And there's a famous report by the Institute of Medicine that enormous numbers of errors are occurring now. Whether that report is, let's say, totally unbiased, that's another matter, but it's fair to say that there are substantial errors that occur, and the hospitals and the healthcare system are doing enormously good things, but it's kind of like a shuttle flight in many ways. When a patient comes into a hospital and they have to go through a number of different procedures, and then finally they make their successful flight and leave the hospital cured or healed. That errors could occur along the way, and stopping those errors is a huge deal. I mean, the subtle things like falling or things that could have a disastrous impact.
Oh, most likely it impact a person, you know, and their family, physically, emotionally, financially, absolutely. And implementing one of the other practices that we've implemented, and you probably see this too in your setting, is bedside medication verification. You know, looking to see how technology can assist us. So now what we do is the medicines are profiled for that particular patient, they're coded what their allergies are, and when the nurse goes in to deliver the medicine, the patient's armband is scanned, the medicine is scanned to ensure that it's the right medicine being delivered to the right patient at the right time and the right dose. So those kind of safety measures, whenever we can build in safety measures that are foolproof, you know, with the behavior is very critical related to doing the right thing and being accountable, but also looking for processes that we can put in place with technology to make it almost impossible to cause an error.
Yeah, one of the things that's sometimes talked about is the transmission of new technology or new ideas into the general hospital settings in America. So you've named a number of things that are cutting edge. How does Houston County get that technology, get the ideas? How do you do that? I mean, how did you come up with all these things?
Well, being involved with different associations, Georgia Hospital Association, we're members of that, reading the most current literature, being part of certain initiatives. Right now we are going to be joining with the Agency for Healthcare Research and Quality, to where we are looking at the best practices they have and implementing a better medication reconciliation process. So by looking at some of those things and implementing those in to our practice, one of the other things that we did a year ago in December was we integrated electronic ICU into our ICU departments at Houston Medical Center and at Perry Hospital. And what this does, it's a tool. It's a tool for our physicians to be able to utilize and our nurses to utilize. And we actually have the ability to satellite link with intensivists in St. Louis Hospital. And we have two-way televisions to where we can talk to them. We can call them up in a minute's notice. You know, doctors can't be there 24/7. So that provides us the opportunity to be able to tap into an electronic ICU. And it's one of those things that we do it in collaboration with our physicians here on site.
Well, so you seem to have imbibed a great amount of progressive technology. One of the things that I guess the country faces now, we have a very expensive healthcare system. There are lots of debate and conversation about what to do about these extraordinary expenses. Is your team, do you think about things like that? I mean, trying to make things more efficient or dropping costs? Do you have that? Is that part of your mantra? But there's that another softball?
Well, it is, absolutely, it is. I mean, one of the things you might hear is no margin, no mission. We are a business. We do, you know, of course, have to work very hard. We don't get any county money at all. So
you don't?
We don't. We get no county money.
Not even one shekel?
No shekel, no shekel.
Right.
So we have to have those conversations, and we have to really look at the way we operate. We encourage our employees to assist us in coming up with thoughts and ideas related to balancing the budget. But we also do really believe and buy into, again, the board, the executive team,
yes,
the staff, that if we provide quality care to our patients and do the right thing, we'll save money.
You know, I think this is another thing that's, I think, entering the national psyche is the concept of healthcare value. So one of the things that I think is the important thing is if you have a substantial medical problem, and you can absolutely have that fixed, and it's finished and it's over with. If some additional expense occurs when it's to have it fixed, you still get good value. And contrary-wise, if you don't fix it and you maybe not spend quite as much money, it's still not a good value issue. So that's the idea of being able to, in outcome analysis, just really have a healthy, happy population is a big thing, isn't it?
It most definitely is. I mean, even the idea related to encouraging the community to get a flu shot, get their vaccine, get their pneumonia. I mean, there's that herd immunity to where if you can really encourage everybody, 90% of your population, you can really decrease the other people from coming down with the flu or pneumonia and things like that. So those kinds of things encourage the community. We have an outreach program called Educare, to where we do have programs for the community, to where whether we have smoking cessation programs, programs on hypertension, helping you to manage your hypertension and make sure that you are doing the right things to lower your blood pressure, congestive heart failure, making sure that you're weighing yourself and eating the right kinds of things. So those kinds of things, it's not just a matter anymore where a hospital is one entity. We really do need to reach out and have some of those community programs to keep everybody healthy.
Well, thank you. It's been a very stimulating conversation, and we hope to have you back again, and keep up the good work in Houston County. Thank you.
Well, thank you. We appreciate your support and allowing us to come be here with you.
Thank you.
This program is brought to you by the Georgia Neurosurgical Institute. For over 50 years, rendering neurosurgical care to patients of all social conditions, treating complicated problems involving the brain, spine, spinal cord, and peripheral nerves, endeavoring to encourage quality care, medical research, innovation, and education on a local, national, and international basis.